What happens when a woman seeks the help of a professional, a doctor, a man or a woman of medicine, and they find that they are sexually assaulted? Devastating, awful experience. We have two women joining us right now. They agreed to be a part of the show if we would protect their identity. Indeed, we will. We will call them Mary and Jane. They came together in court because they were both raped by the same doctor. And the story is fascinating. This man has been convicted, 3 to 5 years at Walpole. He is out pending appeal, and they have quite a story to tell. I think we should begin with you, Jane, because you worked for this neurosurgeon. You trusted him, no suspicion that he was involved in anything like this, and then 3 years after working for him, you had back problems, and he became your doctor.
Yes, I trusted him as a doctor and a friend, and to come to my home and treat me for a back injury. I really can't believe something like this could happen.
How long ago for you?
It was 1.5 years ago.
All right, and Mary, for you, it was 4 years ago?
4 years ago.
Now, you did not go to trial. You did not press charges against him, right?
That's correct.
You went to help Jane.
Yes.
How did you find each other?
I was very curious as to what was happening because I had been reading a little bit of this in the paper and found out who the DA was and got in contact with him and wouldn't tell him my name. And he said, "We really need you to make this case even stronger." So instead of bringing the case up myself, which means going through the grand jury, and it's a very lengthy process, in helping out the original case, it was much more powerful.
For you to go in. What happened? I mean, first of all, it seems strange that a neurosurgeon would make, or any doctor these days, a house call. Was it because of the friendship that he did this for you, Jane, or was this his MO, his way of dealing with patients?
Well, I was friendly with his secretary, and it was suggested that Dr. Helfant would come to my house and examine me and prescribe a course of treatment since I was unable to get out of bed. And I knew that he frequently did this kind of thing, and I had no reason to mistrust him.
What happened?
I was told that I had severe muscle spasm in my back. He gave me an injection of valium, which rendered me unconscious. And many hours later, I realized what had happened. I could remember bits and pieces of being raped, and it took a little while for everything to all come together. And then at this point, I decided to go ahead and go to the hospital. And
You mean that although you were floating or whatever was going on mentally because of the Valium, you were aware were you aware at any point that he was on top of you, that this rape was happening?
Yes, I was. At 2 different occasions, I was aware that this was happening.
Were you not conscious enough to say anything?
I felt like my body was a lead weight. I remember saying a couple things to him, and I remember just blacking out after each time. I remember waking up.
And then how and when did you finally realize consciously that this had happened?
Well, I received a phone call from a friend of mine, and I just started talking about what had happened, and then I broke down and started crying, and she said, "What happened?" And at this point was the first time I really realized what had happened to me.
Was it violent in any way?
No, not that I can remember.
I guess it can't be because you couldn't fight.
Right.
The danger of putting someone in that, giving that much Valium to render you immobile in your home, isn't that medically dangerous? How about for you, Mary? Did that happen to you too?
Yes, and it's not until later that we found out that giving someone that amount of Valium in your home is very dangerous because you should always have oxygen nearby, which he didn't do. And to go back for a minute on your last question, Eileen, I think to ask if it was violent in any way, rape is a very violent crime.
I know, and that's, I suppose, what I'm saying here is it only violent when the victim can fight, or is it just violent, period?
Well, that was a controversy in the case, actually, in court, because it wasn't proven that we had actually fought him off of us because we couldn't. And it was finally proven that a woman doesn't have to actually, beat up someone to actually convict him, because he rendered us to a point where we were not able to physically fight him off.
What happened to you?
I was having severe migraines and had gone to many doctors to try to get rid of them, and was referred to this doctor by a different doctor. And he wanted to make a house call, which I felt nervous about, and he understood that, and I purposely had my roommate at the time with me, and she was called by by a severe emergency by a very good friend of hers, which left me alone in my home with him.
Why did you have your roommate there? Were you suspect?
I wasn't suspect of him. I was more suspect of the actual situation because people don't make house calls, and he and I even discussed that. And I did trust him. I didn't feel there was any real worry. But just because people don't make house calls, I thought, well, I'll just be, extra safe. And it basically backfired.
What
and
happened?
Again, you're sort of in a fog, and in that amount of Valium intravenously.
How much Valium? Do you know?
It's 10 milligrams of Valium intravenously, which is it's not like an oral amount.
It's not like taking 10 milligrams
no,
by
no,
pill.
No.
All right.
And so when I did realize what he was doing, and I said something like, why are you doing this to me? But I remember feeling that I was sort of out of my body. I mean, I didn't have any control, because I remember feeling that if I had been on fire right then, I couldn't have moved. It's impossible. And it does affect, another controversy is that that amount of Valium does affect different people different ways. In both of our cases, it was very severe.
So for you then, Mary, did he just left and you were still in this fog, and when you came out of it, what did you do?
Well, I was sort of in shock and kind of hoping it had been a dream. When 2 days had gone by and I was very sure it had happened, I finally told my roommate, because I thought that I was just going to explode. And it's such a shock to have gone through something like this, because you just, as horrible as it is for a woman to think about this, you never think it's going to be you.
This man was acquitted on a similar charge with a 17-year-old girl prior to this happening. Are you the only the only three that you know of, or are there others?
Well, there was another woman who came forward with us who was not actually raped, she was molested. And our feeling is that there are many women out there with this, possibly with this Dr. Helfant, possibly with lots of other doctors. And I think your initial feeling is, did I do something wrong? And every person who I've talked to who has gone through a similar experience felt some sort of guilt and shame.
Looking back, was there any part of him that suggested in any way that he would do this?
Not for me, certainly
Jane,
not.
you worked with him. Was there anything?
Well, he always had a manner at work where he was popular with women, and he would talk to women a lot, and occasionally flirt and that type of thing with them. But like I said, I trusted him as a doctor and a friend, and I just never had any reason to mistrust him.
You've told your family, Jane.
Yes, I have.
And how have they? They've been supportive?
They've been very supportive through the whole ordeal.
But Mary, you haven't been able to do that, and it's been 4 years. Why?
Well, I guess a fear of just hurting them so terribly, and but it's still pulling at me because we're very close, and I'm sort of envious of seeing her family go through this, with Jane, her family being there and all of her friends, and me not being able to have my family there. So it's a tough decision, and I haven't made a final decision yet.
But you did not do this. He did.
I know, and I finally realized that after going through the court and realizing that, the blame and shame is not mine, it's his. And I feel stronger each day and feel that I may tell them soon, but I don't know what can be the deciding factor. I think it might have been easier for me if they had been aware of the situation.
I think so too, but it's interesting that before we began this segment, the two of you were squeezing each other's hands and giving each other courage. I think that's pretty special. It's amazing. I mean, we have two psychiatrists that will join us in a moment who have done a lot of research on this subject. Are we dealing here with a man who's a womanizer or someone who's sick? There's so many questions to ask. Mary and Jane will stay with us, and we will invite these two doctors who have done a great deal of work to join us. So sorry if it's a naive question, but are we dealing with a womanizer who just feels that everyone is there for his taking, or are we dealing with someone that is truly sick? Is there any kind of a fine line?
I think it happens very rarely, and we should establish that this isn't an everyday occurrence. It happens all too often, but it is rare. And every case is not the same. That there are some middle-aged men who are depressed and get into womanizing because of their own sickness and depression. There are some people who are just scoundrels and who want to get away with anything. And I think that there's a distinction to be made.
Mary and Jane, do you have a feeling on this?
Jane, do you?
Which is it? Is this man a scoundrel?
I didn't feel like he was a womanizer at all. I didn't feel him flirting with me. I felt sort of a fatherly support and an understanding of what I had been going through, because I had been going to doctors for so many years with these migraines.
He did all this in the guise of being fatherly
Absolutely.
and helpful. Yeah.
And again, I think, you feel that, doctors are doing the right thing for you. And I know that this big chunk that he's taken out of my life for the past 4 years that I'll never get back, and I think about it every day, and I really worry going to doctors now. And he did that to me. And I don't think that's fair, because he's a very small percentage of what doctors are all about. I think most doctors care so much, and they have no idea why I might be really afraid to go to them.
And it would be important to emphasize for the viewers and the listeners that your story of confusion, guilt, and shame is very, very common, even in less dramatic and in the civil cases.
And the
of seduction.
difficulty later trusting doctors or therapists who are people who you still need somebody to treat your migraines, you still need somebody to treat all the psychological damage, and it's very difficult to trust people.
Well, let's get into
afterwards.
that for a moment, the awareness. How can you tell if someone's going too far? I mean, there was no way for Mary and Jane being drugged to know that, obviously in this case. But how do you know if it's just, because being molested is just as awful as penetration, as actual rape for a woman. How do you know? Where do you draw the line?
I think it's absolutely too far any time there's physical touching in a doctor-patient relationship or in a therapist-patient relationship that goes beyond the needs of the exam that you contracted for. And that any time you feel like it's gone too far, that a person in a patient situation needs to speak up.
Mary and Jane, would you suggest for them that they have some therapy, that they really talk this out? Is it important for the victim?
Well, it's crucial, I think, that the victims talk it out. The exact place and setting and with whom is an individual matter.
All right, one final question. Do you think that it would help Mary if she told her parents, shared the pain?
I think it's very important to be able to speak with the people who you feel closest and most comfortable.
Kind of resume a
with.
trust relationship
And-
with someone, huh?
And to realize that there are still people who you're afraid that you've hurt who are on your side.
I
and
thank you
continue to be.
both, Dr. Roberta Apfel and Dr. Bennett Simon, thank you. And Mary and Jane, thank you. I know you would encourage anyone who might be feeling this, knows that it's happened and frightened to report it, to do so. That has helped you, hasn't it?
Absolutely.
All right,
Yes.
thanks an awful lot.